day everyone. In today's video in the MMT series we will be discussing the MMT of the muscle trapezius. Now the trapezius muscle is divided into three fibers: upper fiber, middle fiber and lower fibers. And upper fibers of trapezius and the levator scapulae muscle, they are tested simultaneously. The origin of the upper fibers of trapezius is external occipital protuberance, medial 1/3 of superior nuchal line, ligamentum nuchae and spinous process of the 7th cervical vertebrae. And its insertion is lateral 1/3 of the clavicle and acromion process of scapula. Nerve supply is accessory nerve or 11th cranial nerve. And its main action is to elevate the scapula. This is the upper fibers of trapezius. So it elevates the scapula, and with the reverse origin and insertion and acting bilaterally, the upper trapezius, it extends the neck, and when it is acting unilaterally, the upper fibers, they extend laterally flexed and rotate the head and joint of cervical vertebrae so that the face turns towards the opposite side. And the levator scapulae, its origin is from transverse process of C1 to C4. Insertion is on the medial border of scapula and root of the spine of scapula. Nerve supply is dorsal scapular nerve and the root value is C4, C5. So this is the main origin of the upper fibers of trapezius and the levator scapulae. Now main action of the levator scapulae: with origin fixed, it elevates the scapula, and with the insertion fixed and acting unilaterally, it flexes the vertebrae towards the same side. And when it is acting bilaterally, it helps in the extension of the cervical spine. Now the manual muscle testing of these muscles, that is upper fibers of trapezius and the levator scapulae, they are done simultaneously. So position of the patient will be that the patient will be sitting over the side of the table and the hands are in the relaxed position. The therapist will be standing just behind the patient, and we have to ask the patient to shrug his shoulders, and we have to apply the resistance. The hands for applying resistance will be over the top of both the shoulders, and force is applied in the downward direction. And we have to instruct the patient that shrug your shoulders, hold them, don't let me push them down. So this is for grading, grade 5. If the patient is able to shrug his shoulder and maintain the position against maximum resistance, then we award grade 5. And grade 4 if he is able to tolerate the sub-maximal resistance. And grade 3 will be awarded if the patient is able to perform the movement with full range of motion, but he cannot tolerate any amount of manual resistance that is given by the physical therapist. So this is for grade 4 or 5, and grade 3 if the patient is able to do the movement against gravity. For grade 2, the patient is allowed to lay down either in the supine lying position or in the prone and is asked to do the same movement. So grade 2 is awarded if the patient is able to perform the movement in the above posture, that is the gravity eliminated plane. And grade 1 is awarded if the patient is not able to perform any movement, but there is a palpable contraction of the muscle, and the site of palpation will be the upper fibers can be palpate near its insertion or near the cervical vertebrae. And the palpation of levator scapulae is not possible because it is very deeply situated in the body. And grade 0 is awarded if the muscle does not have even the contraction activity. So this is the position for grade 1. Now the trapezius muscle, as I said, that it is divided into upper fibers, middle fibers and lower fibers of the trapezius. So next we will be discussing the middle fibers of the trapezius. So this is not medial, this is middle. The origin is this muscle is originated from the spinous processes of first thoracic vertebrae to the fifth thoracic vertebrae, and insertion is in the medial margin of the acromion process and the superior lip of spine of scapula. Now action: with the origin fixed, it causes adduction of the scapula, and when there is a lateral rotation of the scapula, it is performed by upper and lower fibers of the trapezius, so the scapula is stabilized by the middle fibers. And its nerve supply is the accessory nerve, and root value is ventral rami of C2, 3, 4. Position of the patient for testing the middle fibers of trapezius is the patient is in the prone lying with head turned toward one side, and the shoulder is abducted up to 90 degree and is laterally rotated. And the position of therapist will be, the therapist stands on the test side close to the patient's arm. So these are the middle fibers of trapezius originating from first thoracic vertebrae to fifth thoracic vertebrae. And test we have to perform is that the patient elevates the arm, maintaining the position of the shoulder joint, and the therapist will be placing his or her hand for applying resistance against the forearm proximal to the wrist joint, and the resistance is applied towards the downward direction. And we have to give instruction like lift your arm towards the ceiling or the sling and hold it, don't let me push it down. And if the patient is able to perform this movement against maximum resistance, grade 5 is given. If it is he can tolerate the sub-maximal resistance, then grade 4 can be awarded. And grade 3, if the patient is able to perform the movement with full range of motion against gravity, but he cannot tolerate any amount of manual resistance. So this is a position for middle fibers of trapezius. The arm is abducted at 90 degrees at the shoulder joint, and it is laterally rotated. For grade 2, the therapist will cradle the patient's arm. So we have to support the weight of the patient's arm, and grade 2 is awarded if patient is able to do the movement when the therapist is supporting the patient's arm. And grade 1 will be awarded if the patient is not able to perform the movement, but there will be palpable contraction. And for the site of palpation, the therapist has to place the fingers of hand at the spine of the scapula from the acromion process to vertebral column. And grade 0 if there is no palpable contraction of the activity. Next is the lower fibers of trapezius. So its origin is from the spinous process of 6th thoracic vertebrae to 12th thoracic vertebrae, that is T6 to T12, and insertion will be tubercle on the spine of the scapula. Now its action is depression and adduction of the scapula, and nerve supply is the ventral rami C2, 3 and 4. So for muscle testing, the position of patient over here will be, the patient will be prone lying with the arm to be tested overhead to be about 145 degrees of abduction. So in lower fiber it was 90 degree of abduction, but for the lower fibers it is 145 degrees of abduction, and forearm is in the mid position with the thumb pointing towards the ceiling or the sling. So head may be turned to either side for comfort. So positions of the therapist, that the therapist stands at the side to be tested at the level of the patient's arm. So we have to ask the patient to raise arm from the table to at least the ear level and hold it strongly against resistance. So this is the origin of lower fibers. And resistance will be applied over the forearm proximal to the wrist joint in the downward direction. And the instruction, we have to ask the patient to raise your arm from the table as high as possible. Hold it. Don't let me push it down. And for grading, again, if the patient is able to perform the movement against maximum resistance, grade 5, against the sub-maximal resistance, grade 4. If the patient is able to perform the movement against gravity, but he cannot tolerate the resistance, we award grade 3. And for grade 2, the therapist will cradle the patient's arm under the elbow, and if the patient is able to do the movement, grade 2 will be awarded. For grade 1, there will be palpable contraction of the muscle, and the contraction activity can be palpable in the triangular area between the root of the spine of the scapula and the lower thoracic vertebrae, that is along the course of lower fibers of trapezius. And grade 0 will be, there will be no palpable contraction. Thank you.